Good morning, everyone. I'm here to present about restraints in healthcare. So, to start off, we'll be starting with the definition of restraints, and then we'll be looking at the types of restraints that we see in healthcare, and then the situations where we have to use restraints in the medical field, and then finally, we'll be looking at a case study to actually understand the ethical dilemma decision making behind restraints. So, what is restraints? Restraints are a form of medical treatment that we have to use in healthcare when patients to actually restrict a patient's movements. This is used as a last resort because restraints can be a very traumatic experience for a patient. It so a doctor will try their best to look at other options than using a restraint. There are many types of restraints. These are a few. Uh, t- First of all, we will look at physical restraints. Physical restraints are a situation where a patient is held down by one or more members of the staff. This can be seen in emergencies if a patient suddenly becomes aggressive and starts to punch people around them. The doctors will have to hold them down. And also, when it comes to children, when you are giving them injections, normally a parent will be there to hold them down. Next is mechanical restraints. This is by using special equipment. For example, Velcro belts that you see in tying the patients down to the beds. There are special mittens in ICUs when it comes to children to prevent them from disrupting the IV infusions, and also heavy belts in chairs, and normally use heavy lap trays when it comes to older people, and also bed rails are an example. This is to prevent a patient from falling from a bed. This is how you restrain a patient to a bed. You can see that the arms and the legs are tied down, and also the use of bed rails. The next is technological surveillance. This is more of a distant restraint than mechanical or physical, because the patient will have a more freedom for their movements. The staff won't be there with them, and they won't be tied down. This is used normally as a way to alert the staff about the patient's movements by door alarms. The staff can know if the patient is moving, if they are going out of the room. So these are examples: the CCTV and pressure pads, and also door alarms. Next is chemical restraints. This is by using anesthetics, and also you see this in psychiatric patients, especially in agitated and uh, aggressive patients. You use chemical restraints to actually calm the patients so that they won't harm themselves or anybody around them. Next is psychological restraints. This is normally just by giving instructions to a patient. This is more of a less restrictive restraint. Here, for example, a doctor might say that the patient can't move or walk on their own without the assistance of a nurse, or that they cannot get out of the bed. So by saying this, the doctor might be taking away the patient's lifestyle choices, and they will be restricting the patient somewhat psychologically. So when do we use restraints? Like I said before, it is to restrict the movement of a patient. But why they use it is normally to restrict any harmful movement that a patient that might harm themselves and also the staff or any other patients around them. Normally, like I said before, restraints are used as a last resort. So doctors will look at other methods that they can use, and then finally consider restraint if they have no other options. So restraints are an extreme method when you consider all other medical treatments. So it's only used as a last resort, and when they do use restraints, the patients need special care because the medical staff, that means the doctors and the nurses, have to look after their needs, and you have to make sure that the patient is as comfortable as possible, as comfortable as they can get when they are restrained. So they have to look after the patient's hygiene. They have to provide them proper meals at the proper time, and sometimes if they are mechanically restrained, they have to actually do some muscle movements, and they also have to check if the restraints are too tight, because these mechanical restraints especially can injure the patient. They can bruise them, and also if the patient struggles against the restraints, they can break their arms and hurt themselves more. And also it might cut off the bloodstream to their hands and their legs, which will be a severe consequence, because that will lead to tissue damage. So these patients need extra special care, and they need close monitoring. And in these situations, the doctors and nurses actually they reevaluate the patient at least every 1 to 5 hours. This can be within the health policy. This is to make sure that the restraints are actually helping the patient more than harming them, to check if it's actually beneficial to them. And especially in psychiatric settings, the use of restraints have certain guidelines. So if the doctors do not stick to the guidelines, they cannot legally justify the use of restraints. For example, an example for this guidelines or this legal act is the Mental Health Act of 2007. They specify the type of mentally disordered patients that the doctors can use the restraints on. So to move on, the ethical dilemma and decision making of using restraints. So there are four values in making a decision in an ethical dilemma. So these are autonomy, beneficence, non-maleficence, and justice. But the two most important values of these in using restraints is beneficence and autonomy. Uh, Most of the time, the use of restraints can be without asking the consent of a patient. So this will be disrupting their autonomy, but the doctors really have to look at the treatment as if it's beneficial for the patient. So if it's beneficial to the patient, they can disregard the autonomy factor, because sometimes a patient might not like being restrained, especially if you consider a dementia patient, but it can be for the good of them. So in this case, it's a huge ethical dilemma for the doctor, because the patient is actually refusing the treatment, but they know that it can be beneficial to the patient. So this is the huge ethical dilemma in making the decision to use restraints on a patient. So to move on to our case study, this is a case study of an 88-year-old woman with dementia. She is actually being treated in a nursing home, and while being treated for dementia, she is also being rehabilitated to walk. First of all, she is under psychological restraints, which we all know, like I said before, is a lesser restrictive method, restrictive restraint. So she is under psychological restraints, and she is told that she cannot walk alone without the supervision of a nurse. But one day she actually tries to walk alone, and she falls and injures herself. It's a head injury, but it's not severe, but she starts bleeding anyway. So she is treated and taken back to the nursing home. So now the doctors have to make the decision whether or not to use a more restrictive restraint without just using the psychological restraints. But this patient has dementia, and she is not mentally competent enough to make the decision herself. And she actually refuses the treatment or the restraint. But the doctors decide against her objections to use a heavy lap tray on her wheelchair, so that she won't be able to get up on her own and walk. So the patient does actually complain against the restraint, but the doctors have to stick to this restraint. But they do regularly reevaluate the patient's condition and check to see if the restraint has more benefit to the patient than it is doing harm to her. So until the patient is actually recovered and rehabilitated to walk, they keep using the restraint, but by re-evaluating the patient, they use lesser restraints like Velcro belts in the wheelchair than a lap tray. So after after actually her treatment is over, she can walk on her own, but still under the supervision of a nurse. So here you can see the huge dilemma when a doctor has to decide to use a restraint when actually the patient is refusing it. So these are the references for that I used for my presentation. So thank you.